Indication for use of rabies immunoglobulin and rabies vaccine. It should be remembered that not every animal carries rabies, and although the possibility should be borne in mind for every animal bite, the treatment provided is dependent on both the certainty of the presence of the rabies virus in the animal and the immunization state of the patient. So let's look at the condition of the animal treatment. At time of attack, during observation, vaccine preceding immunoglobulin administration. So at the time of attack, if the patient is if the animal is normal and the patient is normal and no change after 10 days, do not vaccinate. You give the first dose. At time of attack, if the patient is normal, during observation, if there is confirmed signs of rabies after 10 days or unconfirmed sign in animal, and treatment, you initiate vaccination in patients upon first sign of rabies in animal, and initiate vaccination. Stop if animal is normal on day 5. And also give according to the guidelines. A strong suspicion of rabies and also rabies, you rabies confirmed, the continued vaccination regime and immediate vaccination, and you give according to guidelines. Patients vaccinated within last 3 years, day 0, infiltrate wound and around wound with rabies immunoglobulin as 10 IU per kilogram body weight, and rabies immunoglobulin 10 IU per kilogram body weight by IM injection, and 1 milliliters rabies vaccine by IM injection. Day 3 or any day up to day 7, 1 ml rabies vaccine by IM injection. The patients with no vaccination or more than 3 years since vaccination, day 0, we infiltrate wound and around wound with rabies immunoglobulin 10 IU per kilogram body weight, and rabies immunoglobulin 10 IU per kilogram body weight by IM injection, and 1 ml rabies vaccine by IM injection, days 3, 7, 14, and 20. Evidence showed that when this vaccine is injected into the gluteal region, there is a poor response. So always use the deltoid muscle, or in small children the anterolateral thigh, to give the IM injection of rabies vaccine. And always complete the rabies vaccine monitoring form. Check availability of treatment for the next patient. The first dose of anti-rabies vaccine must be given whilst observing the presence of or absence of the rabies in the dog. Also, these guidelines are prepared with respect to the use of rabies immunoglobulin of human origin and human diploid cell rabies vaccine. Or the use of other products, we seek advice and guidance from the pharmacist or SMO public health at either regional or district level. So rabies immunization, prophylactic immunization should be offered to those at high risk. For example, laboratory staff working with rabies virus, animal handlers, veterinary surgeons, and wildlife officers likely to be exposed to bites of possibly infected wild animals. Rabies vaccine IM, give 1 ml on each of days 0, 7, and 28 booster doses. Days 0, 7, and 28. So booster doses should be given every 2 to 3 years. Referral criteria: refer to a tertiary center when symptoms of rabies set in.